ELANA is a trifocal lens with a long tradition on a new platform. It is a hydrophobic acrylic material with a classical C-loop type of fixation elements with low risk of side effects and excellent performance. My name is Professor Auffarth. I'm the chair of the Heidelberg University Eye Clinic. At the Eye Clinic we also have the David J. Apple Laboratory and my clinical research group, the IVCRC group. And I'm leading that since, I have to say, almost 20 years. So ophthalmology is a very nice specialty, and it's much, much bigger than the small eye appears to be. So you're here at a very historic ground. The Heidelberg University is more than 600 years old, was one of the oldest universities founded in Europe. The University Eye Clinic itself is a mid-size eye clinic. We have a pretty fair volume of surgery, between 4,000 to 5,000 surgeries a year, and we are more or less worldwide specialized in intraocular lenses, new implants, and the David J. Apple Laboratory has a worldwide renowned reputation. David J. Apple Pathology for Ocular Pathology, or actually it is now called the International Laboratory for Ocular Pathology, came from Professor David Apple. Professor Apple was a pathologist and ophthalmologist from the United States. Over years we became friends, and when Professor Apple passed away, I inherited physically this lab officially. It was moved from MUSC to Heidelberg University, and here we extended the whole setup in completely new areas. The core competence of ocular pathology is of course still there. We are one of the biggest centers for implant registration and implant pathology, but we also develop techniques to evaluate biomaterials. So the lab has gone very far since that time. Okay, and now we put the lens in. This goes very smooth. Very nice. And in we go. Very good. The AT ELANA is the next-gen type of trifocal lens from ZEISS, following the AT LISA 3. And the AT LISA 3 was kind of a gold standard, one of the first trifocal lenses, and set the bar very high. One thing that is very important is that the optical features are transferred to a new material. It is a hydrophobic acrylic material with a classical C-loop type of fixation elements. And this is already a big move, and it's not so easy to transform these kind of optics from one material to the others. So the first question was, is there an inferiority to the standard or is there superiority? What we're checking here in the lab is that we do so-called accelerated aging, where we look if this hydrophobic material has any risk of performing so-called glistenings. Then we have a digitalizing camera where we see pictures like you see here. This is a competitor lens from a different hydrophobic acrylic material, and this is a kind of worst case scenario that you have sometimes with the glistenings. You see that the entire optic is covered here like a snowstorm with these little microvacuoles. When we do the same testing with the AT ELANA, we can see that there's essentially nothing there. Yeah, we can see some individual spots here which are partially from the lens and partially also from the plastic dish where it's put on. So essentially the AT ELANA, you see here also the diffractive structure, has more or less no glistenings, which is extremely important for this type of trifocal technology.
Besides confirming the principal optical parameters of intraocular lenses, such as the nominal power, we can use this device also to measure the through-focus modulation transfer function, or the MTF as we call it. And the through-focus MTF can help us to understand how much resolution the lens can produce at different distances, or how much detail it can capture at each distance. And here we see the through-focus MTF of the AT ELANA. We see those three peaks corresponding to far, intermediate, and near distances. We can also include various corneal types that account for the variability of spherical aberration that exists in the population. And what we did was looking at how the lens performs under all those challenging conditions.
We could see that the AT ELANA under all conditions performs almost identical. Yeah, so the MTF curve and the defocus here, the performance of the lens was more or less identical and not influenced by all these parameters. There are others on the market which under certain conditions completely lose several features. Yeah, so this was quite interesting. Another thing that we did was to look at these conditions in terms also of decentration. What impact does that have? And again, if you have decentration here, AT ELANA performed straightforward under all of these conditions, and some of the other completely lost their performance at a certain condition or over the time. So the more decentration, the less performance they had. So here we see another excellent advantage of the AT ELANA. Okay, now we will do cataract surgery with implantation of one of the first ELANA trifocal intraocular lenses. We have a 67-year-old patient, a female patient here, and we will do the first implantation today on the left eye. We're doing this using the Artevo microscope in the 3D display. Now we go for the implantation and the loading. So here we have the lens being in place very nicely, you can see. We fill this up with the viscoelastic. We use quite a bit of viscoelastic here to make sure everything is fine. The lens comes pre-loaded. Now we hear the click. Now we move it forward. Now it's already in the anterior part of the. Now we implant the lens. As you can see, we go through very nicely. Now it's coming out, unfolding. First haptic. You can see here very nicely the AT ELANA in place. Okay, that's it. The implantation was smooth and very nice, especially the capsular bag performance. I expect a lot. AT ELANA is a trifocal lens with a long tradition on a new platform with low risk of side effects and excellent performance. So I think my expectations were high, but they were met already.